We already know that passive smoke is harmful to children, but a new international study involving researchers in Tasmania has found that children who are exposed to their parents' cigarette smoke may suffer irreversible damage to their health in later life. Dr. Seana Gall is from the Menzies Research Institute and is one of the authors of the report. She joins me now from Hobart. So, Seana Gall, how does being around smoke as a child affect you as you get older?
So what we found was we were looking at the elasticity of young adults' arteries. So they were aged about 35 when we looked at their arteries. And we were looking at the ability of the arteries to expand or contract. And we found that those people who'd been exposed to parental smoking had less of an ability for their arteries to expand or contract. And this is indicative of having poorer cardiovascular health.
And how long do these adverse effects last for?
So the study that we did, it was in two different populations, one of them in Australia and one in Finland, and we actually showed these effects over between around about a 20-year period. So they seem to be very long-term effects and perhaps irreversible.
And did you look at how much smoke produces these less elastic arteries? Is it just children and parents who are heavy smokers who are affected, or is it just a regular exposure to smoke?
Yeah, so it was the types of questions we asked were about exposure to regular smoking by either parent, so it could be one parent or two parents. And we didn't actually have the data to look at different sort of dose responses, but certainly from experience in adults exposed to passive smoking, the more you're exposed to, the more harm you'll be doing to your arteries.
And how hard was it to work out if the damage was caused by smoke exposure as a child, or whether it was the grown-up child's smoking habit itself that was causing it all?
Yeah, and one of the things that was quite surprising and important was that we did take into account all those other things, like whether the children went on to become smokers themselves, and also other sort of classic cardiovascular risk factors like blood pressure and weight. And we actually found that the effect of parental smoking was above and beyond those things. So the parental smoking in itself was causing damage to the arteries, potentially happening in childhood and then following on into adulthood. So it was still evident when they were adults.
And is there any evidence that children of smokers grow up to become smokers themselves?
Yes, certainly, and we've shown that previously in the Australian arm of this study, and people whose parents smoke are much more likely to go on and become smokers themselves. So there is that link there. But above and beyond that, we found that people who were not smokers themselves and had never been smokers still had an effect on their arteries if their parents were smokers when they were kids.
Seana Gall, thank you.
Thank you.